It's another hot day here in Haiti, and as people sit in the shade waiting for their name to be called, children like Fabienne know this is worth it.
Fabienne and hundreds of other children have shown up today at the last mobile clinic that Compassion has organized here in the town of Fondieu to receive much-needed medical attention.
Fabienne is a young girl we met while waiting in line here at the Compassion Project HA204. 17 years old, she tells us that part of a wall fell on her during the earthquake, causing her to have severe headaches and respiratory problems. Today, she has come for a checkup. It's helpful for us, says Fabienne, because if we were injured, we couldn't travel too far to get to a hospital. This is an important part of Compassion's emergency response initiative. Mobile clinics specifically sent out to make sure all 70,000 children in their care are healthy and safe. Throughout the day, hundreds of children are examined, bottles of medication are handed out, inoculations are given, and weight is documented. And those who made the journey know that this is a privilege not to be taken lightly. According to UNICEF, 60% of people living in the rural areas of Haiti lack access to basic healthcare services. And that's why Compassion is here today. Healthcare coordinator Thali Viles says that besides the distance to the nearest clinic, the January earthquake greatly affected the country's healthcare system. This mobile clinic has a lot of good sides to it, says Thali Viles, because after the earthquake, most of our healthcare clinics were destroyed, collapsed, and also we've lost a lot of our medical staff in the country. As a matter of fact, the parents would have to go to the medical clinics to find healthcare, which is impossible for them to afford, and it's rare to find in this community. Otherwise, she says, many parents would be forced to use home remedies for their children's ailments. For both Crossroads Director of Missions David Shelley and President of Compassion Canada Barry Slonwhite, seeing the mobile clinic in operation firsthand is worthwhile. It's the partnership between both of these organizations and your financial donations that helped make this possible.
Well, I love it because they serve the whole person. So we started, when the crisis was early, food response, and then housing, transitional schools, and now the mobile medical clinic so that every child gets vaccinated and checked over in case they picked up any diseases through this earthquake. So I just like the whole ministry, how it just touches every part of their life.
I'm excited because I see the healing presence of Jesus here, right? We look at the life of Jesus and we saw that he cared about the physical person. As Dave said, it's the whole person he cared about. He didn't just preach. And here we're seeing today the healing component of the gospel.
Another true sense of healing for the country of Haiti is the rebuilding of schools. When we arrived here, school had officially reopened, but with some reporting anywhere between 80 to 90% of the schools in the affected areas of Haiti being destroyed, there were few buildings to go to. And with UNICEF reporting that only half of primary school-age children are actually enrolled in school, and less than 2% of children finish secondary education, it was important for schools like this one, run by the Wesleyan Church, to rebuild and do it quickly. This project was really affected by the earthquake, says Pastor Pierre-Marcel Milord, the Compassion Director for this project, and once a Compassion-sponsored child himself. Where we are standing, he says, used to be our school and classrooms. It's gone. In the back to the left, we had classrooms. All gone. The administration that was in front of us is gone. So in other words, we were very much affected by the earthquake here. Compassion Project HA313 lost 5 children on January 12th. And out of the nearly 400 students that attend the school, over half of the children's homes were either damaged or destroyed. So when the parents heard that temporary classrooms were being built and the children would be able to return to at least some sort of normalcy, students started to come back. It's so important because we know that education is prime, says Pastor Milord. Education is our prime concern because with education, these kids' lives can be changed and transformed. So with that, we aim to see them come back again. And according to Crossroads' own David Shelley, hope comes when you invest in children first.
When we talk about rebuilding a country, and I mean, we know that buildings take a long time. We know that structures have to be, demolished and cleaned up. But what's critical and what's really great to see is kids back in school. Their lives are feel more back to normal, even if they have to go home maybe to a tent or to a tough place. At least this is a safe place for them, where they can stay in school, get an education, learn about God. It's just great to partner with Compassion and to do this. So it's great to be on the ground, kind of seeing the transitional school classrooms in place. We'll look forward to seeing when there's permanent structures back here, like there used to be before the earthquake.
You had a deadline.
And for Barry Slaunwhite, president of Compassion Canada, nothing speaks louder than standing side by side with fellow Haitian leaders as they rebuild to a brighter future.
You'll notice all the people working around here are Haitians. They're not Canadians. We are empowering and enabling Haitians to help themselves. And they're busy at work. They couldn't do it without the donors in Canada. The donors in Canada couldn't accomplish it without the people here on the ground. So it's that great partnership that the Bible is so good at talking about.
And as plans for a permanent school building continue to unfold here, it will be these children, the future leaders of Haiti that you invested in a year ago, that will rise to bring hope amongst the rubble.
C'est bon? Merci.